following a National Health Department's announcement last month that children between 12 and 17 years can get a jab. More than 7,000 children received one Pfizer shot on the first day. Now we'll find out how our kids respond to the vaccine and also get an update on the children's trial, which is underway. Lesley Bamford from the National Health Department joined us now live to give us an update on how it's going. Have you had any complaints about allergic reaction or anything like that from parents?
So good afternoon, and good afternoon to the viewers. We've been very happy with how the vaccination of children between the ages of 12 and 17 has started. As you are aware, we started on the 20th of October. We've been vaccinating approximately between 10 and 12,000 teenagers each day. There have been no reports of any severe adverse events. So we have been very happy with the start of the program for this age cohort.
Just explain to us again, please, Lesley, why the children between 12 and 17 only need one jab when those older need two.
So we have seen across the world that some countries have gone straight towards introducing two doses for teenagers, whereas other countries have taken the same approach as South Africa of initially giving one dose. So there are a number of reasons for this. First of all, we believe that children do have, we know that children tend to have mild COVID disease and do have a very good immune response to one dose of the vaccine. There have been some concerns about side effects in children, and some evidence that the side effects are more common following the second dose. So really what we're doing is taking a very cautious approach. Our Vaccine Ministerial Advisory Committee advised that we only give one dose, certainly as we initiate the program. And this allows us to learn from other countries, learn from trials that are currently underway, and in the future we can decide whether we will stick with one dose or we will start to provide a second dose to this age group.
Now, South Africa's aim is to have, I think, the percentage that we want to have by December in terms of herd immunity. Are we reaching that, since you said that it's about 10 to 12,000 12 to 17-year-olds every day?
So let's be very clear about this. The main focus of the vaccine rollout remains to vaccinate adults, those over 18 years of age, and particularly those who are 50 years and older, and even more, especially those who are 60 years and older. And that remains the main focus of the vaccine rollout, because we know that we need to reach those who are most vulnerable of severe disease and death. And we would like to vaccinate as many adults and particularly as many older people as possible before the anticipated fourth wave arrives. So that remains our core business. Our aim is to vaccinate 70% of all adults in South Africa. That remains our target, and we would like to get as close to that target by the end of the year as possible.
So other children, apologies for that.
For vaccine, sorry?
Apologies for that. I just wanted to know the fact that you've had the 12-year-olds to 17-year-olds and also even the 18-year-olds vaccinating. Is that motivating your target to also go out there, those over 50, for instance? Are we seeing more of them come get the jab?
Well, we would hope so. We have seen that demand for vaccination across the board, including in adults, has been not as high as we would like it to be. We have a capacity to vaccinate more people than we are currently reaching. So we really are urging all South Africans, but particularly those 50 years and older, to come out and be vaccinated. During the month of November, we are piloting a project whereby those 60 years and older will receive a voucher following vaccination to offset the costs associated with accessing our services. So we really are encouraging everyone to come forward and be vaccinated. Now that teenagers can be vaccinated, there is the opportunity that families can come together to be vaccinated. The parents, perhaps any grandparents who have not been vaccinated, and the children 12 to 17-year-old can all come forward and be vaccinated.
All right. Thank you very much, Lesley Bamford, for your time here on eNCA. She's from the National Health Department, telling us a bit of information about how far we've come for that trial for children between the age of 12 and 17.